It's a big day in Washington. Anyone who is 16 or older can now get the COVID-19 vaccine. Joining us now is Dr. Larry Corey with the Fred Hutchinson Cancer Research Center. He helps to coordinate the vaccine response nationwide. Dr. Corey, good morning to you.
Hi, Mina. How are you?
I'm doing well. It is a really exciting day for a lot of people that they've been waiting for this vaccine. But of course, let's talk about this Johnson & Johnson news that has a lot of people concerned, of course. Some experts are saying that the key ingredient in the Johnson & Johnson vaccine, also in the AstraZeneca vaccine, could be contributing to the blood clots. And that is different from the Pfizer and Moderna vaccine. Can you talk about the difference and if there's a concern with that?
Well, I think we don't understand what's going on with this very uncommon syndrome that appears to be with the J&J vaccine, about one person in a million. It has some characteristics. It's seen mostly in women. The six cases since the vaccines got distributed have all been in women. There was one case in a man on the clinical trial. The etiology of this is really uncertain as to what causes it. We have worked out an algorithm on how to diagnose it and how to treat it. And part of the cause is to disseminating that information and to also see if any more cases accrue in the next 7 to 10 days, as it appears to occur within 14 to 16 days from getting.
Right. And we know that it's very rare. Like you said, it's one in a million. However, we are telling people you got to watch out for these side effects. And obviously, if you have these certain side effects after getting the J&J vaccine, you should obviously contact your doctor. But people receive side effects with these vaccines, and it's very normal. How do you know when to be concerned after it lasts a certain period of time, several days? I mean, how long should people have these side effects if they do?
Well, shortness of breath, evidence of severe pain in your head or severe pain in your body that would occur with a very large blood clot. Those are the things we're most concerned about. Not mild symptoms, but anything that's associated with a blood clot, a really severe headache. We'd want you to contact your physician as soon as possible and tell them about the vaccine, and if there is any issues associated that there's both a state hotline, a CDC hotline that can be set up or to go to a medical facility. There are some tests that can be done immediately to actually diagnose this. And
lastly, some people are already hesitant to get the vaccine, before this J&J news. And now with this news, some people are saying, you know what, I'm just going to hold off and not get it at all. What does this mean? If you have more people who are not getting the vaccine, what does this mean for people who are fully vaccinated and their risk for COVID?
Well, I would like to emphasize that we have not seen this with the RNA vaccines. So the Moderna and Pfizer vaccines, there have been, 80 million doses of the Pfizer and another 90 million of Moderna that have been given to the country. I'll just say that I had my granddaughter being able to get vaccine. The entire family of mine has been gotten vaccine, including myself. And we have not seen this complication with the RNA vaccines, and that allows us to concentrate on what is really going on, which is we are seeing decrease in hospitalizations, we're seeing decrease in death, we're vaccinating the people at highest risk, we're starting to now vaccinate lower risk persons. There's more RNA vaccines being distributed, and both in our state and in the region and the country. We must continue this because we're starting to see an uptick in cases, and the uptick in cases is variably among the people who have not been vaccinated.
Dr. Larry Corey with Fred Hutch, always great to talk with you this morning. Thanks for helping us get some answers to these questions. We appreciate it.